Hello friends, this is Kavita Kukunur, homeopath from USA. Welcome to Ka Homeopathy Study Group Pro Bono webinar. Good morning, good afternoon and good evening. So nice to see many of you from different countries and different time zones. Before we start our webinar, we always thank Universe for giving us this great opportunity. Dr. Sweta Singh, our Ka Chief Administrator, will start the session.
Thank you, Dr. Kavita. This is Dr. Shweta Singh, Ka Chief Administrator. It's my privilege to introduce Ka Homeopathy Study Group with all of you. Ka Homeopathy Study Group Pro Bono was organized and founded by homeopath and humanitarian Kavita Kukunur, President and CEO of Kavita Holistic Approach, Ka. This study group is intended to be an offering from Kavita to homeopaths around the globe, sharing goodwill and solid clinical work within the classical model. Our foundational principles for the Ka mission and vision are very unique to inspire young homeopaths, mentor, provide excellency for educational purposes using holistic approaches via webinars, which are based on principles of classical homeopathy and provide professional continuing educational homeopathic credits for practitioners. We provide merit certificates for spreading the light of homeopathy around the globe. Dr. Kavita is a member of Kevin Friendly Foundation, a non-profit organization that helps to serve poor people in greater needs in India. She is the recipient of Martha Ullman Community Service Award by National Center for Homeopathy and Best Entrepreneur Award from Dr. N. Lingaraju, Principal of JSPS Homeopathic Medical College, Hyderabad, India. We are extremely happy and proud that we celebrated 11 years of her book, Beyond the Limits, A Challenge to Prove Oneself. And in January, we launched her ebook, A Dose of Spirituality with Kavita, in presence of our honorable Ka speakers, American Institute of Homeopathy, AIH, President Dr. Alex Becker, and Council for Homeopathy, CHC President Dr. Sheetal Tiwari at our Ka webinar. At our Ka second annual celebration, it was a great privilege for us as our honorable guest, Dr. Jawahar Shah, Chairman of Enlightenment Education, launched our book, audio and hard copy. Dr. Kavita donated the proceedings of the book through Ka Study Group platform to various charitable organizations and Homeopathic Association. To name a few are Kevin Friendly Foundation, CHC, DHMA, JSPS College, BT Seva, NCH, etc. We will share the recording link in the Zoom chat box, and interested ones can have the glimpse of the book. Purchase link will also be shared. As of now, we have over 250 plus recordings on professional webinars related to homeopathy, health-related topic, and inspirational talks available on our channel, Kavita Kukunur. This webinar is moderated by myself and our coordinator, Dr. Shrija Yeravalli. It is being recorded as we speak, and we are live on Facebook. We will take questions at the end of the webinar. We will post jot form in Zoom webinar chat at the end of the webinar. Please fill the form to receive certificate. And if you're watching live webinar, email us at kastudygroup@gmail.com. Kindly mute yourself and turn your video off for better connections. Thank you so much. Over to you, Dr. Kavita.
Thank you so much, Dr. Sweta. She manages our Ka activities with cute smile. I thank Ka Homeopathy Study Group entire team for the continuous selfless support with which we are able to make our pro bono activities and webinars so beautiful. These webinars are for educational purposes only and should not misuse any of the course content without speaker's permission. Always seek an expert homeopath for treatment. Being an outreach coordinator of CHC PR committee and HNA CPD provider encourages homeopaths to become CHC certified and to participate at HNA accredited CU webinars. With the deepest gratitude to our master, Dr. Samuel Hahnemann, founder of homeopathy, for gifting us Organon of medicine, which is Bible of homeopathy and modern scientific system of medicine and philosophy. Just like we learn something new every time we hear Bhagavad Gita, The same way, the more times we hear Organon of medicine, we become a better homeopath. Dr. Misha Norland would be super happy watching this event from heaven, as he was on our last year webinar and loved to come back again this year. Though we missed him, his blessings are always with us. We covered Organon in our webinars from great teachers like Dr. Rajan Shankaran, Dr. Jawahar Shah, Dr. Ajit Kulkarni, Dr. Subhash Singh, Dr. Farooq Master, Dr. Krutik Shah, Dr. Divya Chabra, Dr. Joshi, and many more. But today's topic would be very unique. Today, June 5th, 2022, and we have our honorable speaker from Jaipur, Rajasthan, India, Dr. Manish Bhatia, founder and director of hpathy.com, will be sharing very important tips on clinical application of organon of medicine in our daily practice to see best results. This webinar can be a life-changing for you to fulfill your dreams of becoming a better and successful homeopath. Today's webinar will be 1 hour 15 minutes and might extend more if speaker agrees to. No introduction is needed to Dr. Manish Bhatia. Everyone knows him. But for those who are new, Dr. Manish Bhatia, MSc, HOM UK, and MD Homeopathy, is an internationally renowned homeopath with over 20 plus years of clinical experience. A well-known speaker and teacher, his books on Organon of Organon are part of the curriculum worldwide. Dr. Bhatia runs a consultation office at Jaipur, Asha Homeopathy, and is one of the most well-known clinicians in India. Dr. Bhatia is known to treat difficult cases with ease, to name few, treating autism, ADHD, celiac disease in children, to treating schizophrenia, to name few, OCD, anxiety, depression, and cancer in adults. He is known for providing relief in difficult to cure pathologies. He works as an associate professor of organon of medicine and homeopathy philosophy, writes for various journals, runs
Kavita,
homeopathy.
let's keep it short. This is becoming embarrassingly long.
No, Dr. Bhatia, we need it is such a nice thing. You are inspiration to all of us. So just a few more lines, okay? And gives educational and corporate seminars on health and homeopathy. More than 20,000 students have already enrolled for his online introductory courses in homeopathy. Dr. Manish Bhatia is the founder and director of hpathy.com, world's leading homeopathy portal. hpathy.com is today the most exhaustive and respected resource for homeopathy on the internet and serves homeopathy to more than 500,000 people every month. I was fortunate to contribute few articles to Hpathy. And Dr. Manish Bhatia received several awards for his outstanding talents. His website, drbhatia.com, was ranked almost the India's top 10 online health service providers by the business magazine CEO Insights. Dr. Manish received Best Homeopathy Author Award 2020. And let us welcome our honorable speaker, Dr. Bhatia, to our webinar.
Thank you, Kavita. Thank you so much for this very long introduction. Now let's jump to the topic, because this is a very short webinar. So I won't like to spend any more time on nitty-gritty. Now, organon is a very huge topic to cover. It's not possible for anyone to speak about organon in a short seminar. Leave aside short seminar, even for a couple of days, if I speak, I won't be able to give you all of it. There's just no way. The reason I love organon is that because I'm able to see the principles of organon day in and day out in my practice. And that is what gives me confidence in homeopathy. I studied organon before I actually entered into the homeopathic medical college. And it was my love for organon that made me stay with homeopathy. So, but I was very disappointed with the education that was being given to all the homeopaths at that point of time, with hardly anyone teaching Organon, or the Organon being used just as a textbook to clear exams, students using passbooks. And the primary reason that everybody gave was that the language of Organon is very tough, or it's the examples are not there, it's unscientific, we are finding it very difficult, the language is Shakespearean, and all that criticism or the limitations that were being mentioned, they were right to a certain extent. So when I started teaching, I've been teaching Organon since last 20 years in a medical college here. My concern was to make Organon lucid, contemporary, scientific, and very easy to understand. So the theoretical part is all covered in my books on lectures on Organon of medicine. But what I enjoy doing the most is that when I teach Organon to my students, I teach it with clinical case examples. Because it is one thing to teach you theory that, okay, this is written in Organon about case taking, or this is written about one-sided diseases, or this is written about psychiatric diseases, or this is written about female disorders, and to actually show what is written to in practice, to see in cases how the patient speaks the language of Organon, or how to take a case so that you are able to understand where you are using the principles of Organon. And it has been a very enriching journey for me. Now, for today, what I have decided to speak about is, now again, Organon, again, very huge topic. I can only take very small bits and pieces in a short webinar. So what I've decided to speak today about is the treatment of psychiatric disorders as mentioned in Organon. And the reason I've taken this topic for today is because psychiatric disorders are the greatest medical burden, health burden today in our society. There is no one who has not had episodes of mental health issues. And we all see every hundreds and hundreds of cases of anxiety and depression, very, very common. Anxiety and depression are very common. Again, maniac disorders, behavioral disorders, neuropsychiatric disorders like ADHD and autism, purely psychiatric disorders, which like obsessive compulsive disorder, schizophrenia, just to name a few. Just to name a few. There are many other complex pathologies, complex syndromes, even in psychiatry. So what we need to, when we are treating psychiatric cases, we need to understand what is written in Organon, how the psychiatric cases are classified in Organon, and how Hahnemann wants you to approach those psychiatric cases. The reason why it is important to understand what is written in Organon is because, again, there are many schools of thoughts. There are some school of thoughts which focus primarily on this mental symptoms, even for all physical pathologies. They will not even if the patient is giving you a PQRS, very strong physical PQRS, they will not give any importance to it, and will just focus on the mental symptoms part. Now, is this a perfect approach? I'm not saying it's a right or wrong approach. It's just about being a perfect approach, or is it according to the principles mentioned in Organon? So what Hahnemann has done, I'll give you a very brief summary before we actually delve into the aphorisms. What Hahnemann has done is that the psychiatric diseases come as part of one-sided diseases. There's a section of aphorisms on one-sided diseases, and after that comes the section on mental diseases, psychiatric diseases. What Hahnemann has written in Organon is that psychiatric diseases are often treated as one-sided diseases, as if only the mind is disturbed and nothing else is disturbed. If a patient has anxiety, then only the anxiety part is it's believed that it's a psychiatric illness only the mind is disturbed. The physical pathology is not taken into consideration. You'll go much more deeper into the causes of anxiety, the causes of depression, and because that is how it has been taught, that we have to identify, take the symptoms, you take the PQRS, and you try to identify the cause or the maintaining cause, exciting cause or the maintaining cause. So that is what we do. If a patient comes to us for anxiety or depression, we try to figure out why this patient has uh, developed anxiety and why this patient has developed depression. A very simple example would be disappointment in love. Very, very common. And a lot of people, what people do is they follow a very materia medica approach, and they will see that, okay, I have this patient of depression, and then I take the case, and I come at some point of time in the case taking, the patient says that I broke up with my boyfriend or girlfriend, and it probably started there. So we take ailments from disappointment in love and we give whatever remedy comes. The beginner homeopaths often give ignatia, the first choice for most homeopaths. A lot of people will then move on to natrum muriaticum also. But a seasoned homeopath will go beyond ignatia and natrum muriaticum. Because what happens is that it's not just the cause that you have to take into consideration. The expression also needs to be taken into consideration. Is the expression of the patient similar to ignatia or similar to natrum muriaticum? Because if it is not similar to ignatia or similar to natrum muriaticum, then it could be any other remedy. That remedy can be acid phos, that remedy can be aconite, that remedy can be opium, that remedy can be cocculus indicus. That remedy, I'll show you today one case that would be, that is of coffea. Now, why it is important to understand that the etiology, you try to understand this, the etiology, when we say disappointment in love, in no proving disappointment in love happened. Disappointment in love as an etiology is a clinical symptom. Now that etiology is important, but it is a clinical observation, it's a clinical correlation. So when you are actually a clinical correlation of what? Clinical correlation of a certain set of symptoms that arise after a certain etiology, certain causative etiology, certain causative event. So earlier homeopaths have linked these symptoms with this causative etiology, and that is how we know that this particular remedy, which cured these symptoms after this etiology, so we added this etiology to the materia medica picture of ignatia or natrum muriaticum, that, okay, ignatia can be used for disappointment in love. Natrum muriaticum can be used for disappointment in love. But are these the only remedies? What we need to understand is that if you are not, again, you will only realize that if you understand Organon. And Organon says that you have to understand the expression of the patient. Organon says that the symptoms of the patient reveal the inner picture of the pathology. And symptoms alone are the language of the disease. Symptoms, dis-ease, not just the disease. Symptoms are the language of the dis-ease that a person suffers due to any cause. So whenever you are taking the cause into consideration, also take the expression into consideration. So that is the first hint that I can give you from Organon. Now let's move from here. What does Hahnemann say about psychiatric cases? Hahnemann primarily has written that most of the psychiatric cases are not purely psychiatric. In fact, Hahnemann was very, very sure that most of these psychiatric ailments begin at the physical plane. They begin at the corporeal plane, which is the word that Helen has used. Corpus means body. Uh, so Hahnemann has written that most of these psychiatric ailments begin at the corporeal plane, but as time passes, couple of months, couple of years, it can be, the physical symptoms, they become less intense, and the psychiatric symptoms, the mental symptoms, they tend to become more and more intense in certain patients. And at some point of time, the mental symptoms become so intense that the physical symptoms are not perceptible. And at that point of time, the patient and the attendants and the doctors feel that this psychiatric ailment, this so-called psychiatric ailment, is purely psychiatric, and that it's a one-sided disease. And here Hahnemann cautions us that when you are treating a psychiatric case, do not treat it as primarily psychiatric. Look at any physical cause that could have occurred, or any physical symptoms in the history, or any physical ailment in the patient's history. Do not ignore that physical history, even in purely psychiatric cases. Even if you have a case of OCD or schizophrenia, don't ignore that, those symptoms which are arrived, which are probably not there now. But if you take the case well, you will probably find that a couple of years later, patient had certain physical symptoms. And as homeopaths, you all know that no disease is an entity. No disease is an entity. Every disease is a process. Please remember my words. No disease is an entity. Obsessive compulsive disorder is not an entity. Schizophrenia is not an entity. You give that name of OCD or schizophrenia or autism or ADHD to a certain set of clinical symptoms which are very dominant. But nobody develops OCD or schizophrenia overnight. It's a very long process. It's a process like hypertension or diabetes. You do not develop hypertension the day your blood pressure, you go to a doctor with a headache or a palpitation, and the doctor measures your blood pressure and tells you, oh, your blood pressure is 180 by 120, you have got hypertension, you need to be on antihypertensive. The blood pressure did not develop that day or a day prior to that. The process of developing that blood pressure was probably continuing since 5 years, 10 years, 15 years, you don't know. Depends upon the cause, the genetic susceptibility, and the overall history of the patient. Similarly with diabetes. Diabetes doesn't develop the day you measure your blood sugar on glucometer and it comes 200, 300. That day you did not develop diabetes. Diabetes is a process that started much before your blood sugar was even raised. And similarly with psychiatric cases, the patient doesn't develop psychiatric illness the day he or she starts getting obsessive thoughts. The patient doesn't develop schizophrenia the day they start hallucinating. The process of that disease started much earlier, probably in childhood. Probably at some point of time where an exciting cause came into being. Probably they inherited something from their family that predisposed them. And when we are treating these psychiatric cases, we need to make sure that we do not just look at every psychiatric case as having a psychiatric cause. Please remember this. Not every psychiatric case has a psychiatric cause. There are psychiatric cases which have psychiatric cause and they are easy to identify. But there are a lot of psychiatric cases which do not have a psychiatric cause. So when you are treating a psychiatric case, do not overlook the physical history at all. Make sure that you are taking good physical history also. Make a note of every physical disease that the patient has suffered at any point of time in the past. Make a note of the family history also, what diseases the patient, the parents and the grandparents have suffered. And then try to understand what was the nature of this patient as a child, as an adolescent, as a young adult. At what point of time these changes, these pathologies have moved from one to another. Remember, Hahnemann has classified most of the mental diseases as psoric in origin. Nearly all mental health conditions Hahnemann has classified as psoric. And what was psora for him? Hahnemann, when was not successful in treating chronic diseases, he started reviewing the patient's whole history. He started going back to all the past medical history of the patient, and at some point of time, he realized that okay, there are some pathologies that have occurred in these particular set of patients, and which are connected to the current disease condition, and these tendencies that have arisen because of the past medical conditions that the patients have had. These conditions are what he called miasms. He classified them very simplistically as psychotic, syphilitic, and psoric. Psychosis and syphilis was very easy for him to understand. Psychosis came after suppression of figworts, not of gonorrhea. And again, that is again a very big misconception. If you read chronic diseases, a lot of people in general, a lot of homeopaths tend to relate. This is a diversion, but I let it be. A lot of homeopaths relate psychosis with gonorrhea. But if you actually read the book Chronic Diseases written by D. Samuel Hahnemann, you will realize that everywhere where Hahnemann has written about psychosis, it is about figworts. It's about genital warts. It's not about gonorrhea. Only in one place he has said that occasionally these figworts are associated with a gonorrhea-like discharge. But for him, psychosis was related to figworts, genital warts, not primarily related to gonorrhea. So, okay, this was a diversion. Syphilis was very easy to understand. Then psychosis, psora was everything else was psora for him. Probably something originated from an itch-like eruption, which was very common in that time, in that era in Europe. So Hahnemann mentions that everything is psora. What he means by psora? What he means by psora is when he's saying that all psychiatric diseases are psoric in origin. What he means is that most of these diseases begin at a corporeal plane. Some point of time, the patient has had some physical lesions, some physical manifestations, some physical diseases, and gradually, as these physical conditions, these eruptions were suppressed, gradually the patient evolved, the pathology evolved in a way where it affected the mental plane more. That is what he meant. And if you remember how he asked you to treat psora is that you take the whole picture. Your remedy, whatever remedy you say, is anti-psoric. What he says is that you take the whole picture into account. What picture? The picture of 15, 20 years old, and the remedy that you choose is, it should not just cover the end symptoms, the symptoms that the patient has come to you for. The remedy, it might be sulfur or sorinum or any other remedy. There are hundreds of anti-psoric remedies. That remedy should not just cover the end result, it should cover the whole disease process. And when it should cover the whole disease process, it should cover the tendency to have the initial eruptions also. And that is why sulfur or sorinum is given very frequently as anti-psoric remedies, although they are not the only anti-psoric remedies. There are hundreds of them. Remember Bonegason wrote a full repertory on anti-psoric remedies. So it's not just two remedies. Now, so Hahnemann wants you to treat all mental diseases like psoric diseases. And when he says psoric diseases, he wants you to look at all the physical history, all all the past physical history also, and also the family history also. And make sure when you are treating that disease, you just do not cover the end result, but if you are able to find, then also look at the physical aspect and let the remedy cover that. Now, that is one aspect of psychiatric diseases. Hahnemann was not was very naive. uh, Hahnemann knew that there were diseases that were primarily originating from the mental plane also. So what Hahnemann has done is Hahnemann has done this classification. Here is these are also a group of psychiatric diseases. Now he divides them into two. One originating from from physical health problems, and another originating from only from psychiatric uh, causes, mental causes. Now, within these ailments, which are originating from psychiatric causes, again, he divides in two parts. What are those two parts? The mental ailments arising from mental causes are divided in two parts. One, which are true diseases, they need antisoric treatment, and another which can be corrected just by counseling, psychotherapy. Now, you won't believe that Hahnemann has written a full aphorism about psychotherapy. Not exactly the word psychotherapy, but if you actually read Organon, you can see that Hahnemann was absolutely marvelous. He knew the depth and the width of the medical system and the disease processes that he was encountering. So he has given you, if in the fourth aphorism he has mentioned about preventive and social medicine, way back 250 years back, 270 years back. Again, in the mental health aphorisms, which I'll be showing you, he has mentioned about counseling, psychotherapy, and what role they have in treating a particular set of psychiatric ailments. So this is a very, very brief overview of what Hahnemann has written. I'll again summarize for you. Psychiatric ailments are classified as two subsets. One set where the ailments arise primarily from physical problems. Another set where the problems arise primarily from psychiatric problems. The problems which arise from mental causes, they are again divided in two sets. One which need a proper antisoric treatment, other which can be treated merely by counseling and psychotherapy. So this is the classification that Hahnemann gave. And then let's move on and see how Hahnemann asked you to address these. I'll share screen and we'll move from there. All right, so this is a very long presentation. I'll be skipping most of it. So what we'll just move on is this part, the homeopathic approach part. In that general approach, what Hahnemann has written is that there is no powerful medicinal substance in the world which does not very notably alter the state of the disposition and mind in the healthy individual who tests it. And every medicine does so in a different manner. So this is where it began, from the proving. In the provings, Hahnemann first of all observed that every medicine that he was proving, it was affecting the mind. So this was his first observation. And what was his second observation? He said that we shall therefore never be able to cure comfortably to nature, that is to say homeopathically, if we do not in every case of disease, even in such as the acute, observe along with other symptoms, those relating to the changes in the state of the mind and disposition, and if we do not select for the patient's relief from among the medicines a disease force which, in addition to the similarity of its other symptoms to those of the disease, is also capable of producing a similar state of the disposition and mind. So what is he saying here? One thing he's saying is that every medicine produces affects the mental plane, produces mental symptoms. And second thing, he's saying that it is so important that you will not be able to cure if you do not uh, take care of the mental aspects of the patient. And he was so very clear about it that he has written in Organon that there is no aconite without fear, there is no nux vomica without irritability. Very, very clear. These were his words. Now, Hahnemann has given the details about mental diseases in aphorism number 210 to 230. And as I said, that he has classified it in two parts. Diseases originating at physical level and progressing to mental emotional plane, and diseases originating at mental and emotional plane. Now, in aphorism number 210, Hahnemann has written that of psoric origin are almost all those diseases that I have above termed one-sided, which appear to be more difficult to cure in consequence of this one-sidedness, all their other morbid symptoms disappearing, as it were, before the single great prominent symptom. Of this character are what are termed mental diseases. They do not, however, constitute a class of disease, as the condition of the disposition and mind is always altered. And in all the cases of diseases we are called on to cure, the state of the patient's disposition is to be particularly noted, along with the totality of the symptoms, if you would trace an accurate picture of the disease, in order to be able therefrom to treat it homeopathically with success. So Hahnemann was very, very categorical. He was so categorical, he says that mental diseases are not even a class of disease in its own. Mental diseases are just like any other disease in which the physical symptoms are less strong, less visible. But ultimately, whenever you are treating a case, you have to take not just the mental symptoms, you have to take the mental symptoms along with the totality of the symptoms, whatever might be the symptoms, even if they are physical symptoms, physical generals, PQRS symptoms, all they need to be taken into consideration to find out the right remedy. So that is one mistake that a lot of homeopaths do these days, that that mistake occurs because when they are taught in colleges about the evaluation of symptoms in the repertory, in India especially, in the part of evaluation of symptoms in the repertory, when that part is being taught in Indian homeopathic colleges, it is often told that the mental symptoms are the most important. So first come the mental symptoms, and within those mental symptoms, it's will, intellect, and memory. And then comes the physical symptoms. In physical symptoms comes the PQRS, then physical generals, then common symptoms. This is how evaluation is taught in Indian colleges. But what is important is that people don't realize that a lot of mental symptoms are also common to pathology. So if a symptom is mental, if it is arising on the mental plane, is simply, it by itself, it doesn't become more important. Let me give you an example. For example, if a patient is suffering from allergic rhinitis and he's sneezing a lot, he has pollen allergy. Is it a PQRS symptom? Is it peculiar, queer, rare, or strange? No. It is a common symptom of disease, and often we do not even think about it much. We will start looking at the family history, the past medical history, the history of suppression, the mental makeup of the patient in general, to figure out what remedy this patient of allergic rhinitis might require. Similarly, when we are treating psychiatric cases, when we are treating mental cases, what we need to understand is that simply as if a symptom is mental symptom, if a symptom is psychiatric symptom, that doesn't make it important. A lot of mental symptoms, a lot of psychiatric symptoms are common to the diseases, psychiatric ailments that the patient has come before. For example, if a patient comes to me for, say, allergic rhinitis or asthma, and during the case history, if I get to know that this patient has habit of repeatedly checking if the door is closed or not, he'll go back and check the window. He'll go back and check the door if the door is closed. He'll check many things repeatedly. So this becomes a very important symptom for me, because he's suffering from physical ailment and has this mental symptom. So this mental symptom is important for me, which will probably make me think of natrum muriaticum or some other remedy which has this symptom. But if a patient of obsessive compulsive disorder comes to me and says that, okay, I have this problem that I tend to check everything 10 times. I'll close the door and then I'll check the knob. Okay, have I closed it? Then I'll check it again. Have I closed it? Then I'll check it again. Have I closed it? Is this a peculiar symptom? No, it's a common symptom of OCD. So should I give it any importance? Not much. For me, this particular symptom will not point me to any remedy. It's a common symptom. It's just like saying that in malaria you have got fever with chills. Now, fever with chills is a keynote, is a common symptom of malaria. And step ladder pyrexia, it's a common symptom of typhoid. So if a patient who has got typhoid is giving me symptom of step ladder pyrexia. Now, step ladder pyrexia, what is step ladder pyrexia? Fever that increases as the day progresses. It's like the fever would be 99 in the forenoon, and then it will increase to 100, then it will increase to 101, and it will be 103 or 4 by evening. So this is step ladder pyrexia, which is very common in typhoid. Now, if the patient, it's a common symptom of typhoid. So if a patient is giving me this step ladder pyrexia, I'll not figure out my remedy primarily on this. I'll look for other PQRS symptoms, because PQRS symptoms are what dictate our remedy choice. Similarly, when we are treating psychiatric diseases, we need to remember that even, for example, schizophrenia patients, they give you wonderful hallucinations. A lot of schizophrenia patients will give you this symptom. I feel people can read my mind. I feel somebody has hacked my phone and they are able to see all my messages. They can read all my messages. I feel someone is telling me to do something in my brain. Now, you can take these symptoms, but at the same time, you should know their value. They are common symptoms of schizophrenia. Nearly every schizophrenic gives you these symptoms, so they are not very important. In my evaluation of symptoms, I will not weigh them. They are common symptoms. I'll try, even if that patient has got a strong physical general, I'll give it much more weightage than these so-called hallucinations or delusions or compulsive behavior symptoms that a patient of OCD or schizophrenia gives me. So we again come to that topic. Do not ignore those physical symptoms in the psychiatric cases. Look for those physical symptoms. Sometimes they are the anchor, they are the sheet anchor for the whole case. Except in those cases which primarily arise from the mental plane. We'll come to that also. Let's move forward. So in 211, he says that this holds good to such an extent that the state of the disposition of the patient often chiefly determines the selection of the homeopathic remedy, as being a decidedly characteristic symptom which can least of all remain concealed from the accurately observing physician. So this is something we have already discussed. So now we come to the treatment part, what he has written about the treatment of please go through this. Thing is, there's no method. They need to put in the same way, namely by a remedy that goes by the it causes in the body and mind, not just the mind. It causes in the body and mind of a healthy individual a power of producing more, and in no way can be cured. So that is the bedrock on which all cases need to be treated, even if they are psychiatric cases, even if they look like one-sided disease. So now he tells us about the predominantly somatic origin, the right of the mind and disposition peculiar to each of them is increased, while the corporeal symptoms decline more or less rapidly till it at length attains the most striking one-sidedness, almost as though it were a local disease in the subtle. We discussed this part, that most of these mental and emotional diseases arise on the corporeal plane, they arise on the physical plane, but as the disease progresses, the physical symptoms, they tend to become obscure. And gradually they become so obscure that you are left with only mental symptoms. And that is what Hahnemann is teaching us, is that it's never a one-sided disease. So make sure that you take a full history, look at all the physical ailments that the patient has suffered in the past. Make sure that you look at it in the past, because they will give you a key to the remedy. Because with when you're treating a psychiatric disease, they have common symptoms, common mental symptoms. And common mental symptoms have similar, just like common physical symptoms, they have got very low value in the evaluation of symptoms.
Dr.
So
Manish,
do not get excited.
sorry
Yes,
to
Kavita.
disturb you. Some are noticing a little breaking in the voice. Is there anything which you can do, please? A slight difference they are noticing.
Okay.
Thank you.
I'm not sure my signal strength is 100%.
Sure, Dr. Manish, please continue.
Okay. So I'm not sure if it's a network issue, because my signal strength at this point of time is 100%. So I can't do anything.
No
Except
worries. Yeah,
moving.
we are having some network issues. Yes. Thank you.
Okay. So have I lost the share, or do I need to reshare?
We are seeing the screen.
We are seeing the slide.
Yeah, please.
Okay, great. Just a moment. Okay, so aphorism number 215 we discussed. Aphorism number 217. He says, in these diseases, we must be very careful to make ourselves acquainted with the whole of the phenomena, both those belonging to the corporeal symptoms and also, and indeed particularly, those pertaining to the accurate apprehension of the precise character of the chief symptom, of the peculiar and always predominant state of the mind and disposition, in order to discover, for the purpose of extinguishing the entire disease, among the remedies whose pure effects are known, a homeopathic medicinal pathogenetic force. Now, what he's saying, you can read it slowly because we don't have a lot of time, so I'll just summarize it for you. What he's saying is that, okay, you have to take note of the physical symptoms, but at the same time, you also need to take note of the mental symptoms. But what mental symptoms he's asking you to take note of? He's saying the precise character of the chief symptom and the peculiar state. So two things. When you are noting down any symptom, say if the patient is anxious, so you need to note the precise character of that chief symptom, how that patient, why this anxiety developed, when the patient has feels anxious, how the patient feels worse, how the patient feels better. All this needs to be taken into consideration And at the same time, you also need to look at the peculiar characteristic symptoms, peculiar characters of the chief symptoms. Anything peculiar, any PQRS that you can find at the mental plane, that is more important uh, than the simple nosological common symptoms of that nosological entity. They are not very important. Make sure that you are looking at for PQRS symptoms even at the mental level. Now, again, you can only identify uncommon symptoms or rare symptoms or peculiar symptoms in any case if you know what is common. So when you only if you know what is common to a particular disease, you can identify what is uncommon in this particular patient. So you need to have a very good understanding of the disease process also. You need to have a very good understanding of the disease pathology also. You cannot just treat every mental symptom as peculiar, as a very strong evaluation symptom. So you will be able to identify a PQRS only if you know what is common to this nosological entity that the patient has come you for. And that's true for every disease, every psychiatric disease, every neuropsychiatric problem that you will treat if you are treating autism, for example. Now, when you're treating autism, it's not a purely psychiatric disorder, it's just a neuropsychiatric problem, more neurological than psychiatric, but I will give you an example. Now, a lot of autistic children, they tend to walk on their toes. They tend to walk on toes. So when you see your first case of autism and you see this child is walking on toes, you will get excited. Oh, just a moment. My dog has moved the wire. Okay. So when you are seeing this autistic child, the first autistic child that you are treating, and the patient tells you that he walks on toes, you'll get very excited. You look for that remedy that has this symptom, and you'll find in the repertory, you'll find the rubric, walking on toes, and you'll probably find the remedy zincum mentioned there. And you'll become very excited that, okay, I found the remedy for this particular patient or this particular state. But if you know that probably 9 out of 10 autistic children walk on toes and it's a common symptom, you will know that you cannot figure out the remedy on this symptom. It will probably not even value a lot in the assessment, in the repertorial analysis that you're going to make. Similarly, for all psychiatric cases, if you are treating schizophrenia, you need to understand what kind of hallucinations and delusions are very common in in patients of schizophrenia. When you're treating OCD cases, you need to understand what kind of obsessions and compulsive behaviors are very common. What is the expression of the majority of the patients? So only if you know what is common, you can identify what is uncommon. And that uncommon is what is going to give you the remedy, not the common. And a lot of mental common symptoms, they also appear very, very unusual. So you need to have that very good understanding of the disease process, the nosological disease entity also. So this is in aphorism number 217. Then again, in 218, he says that you need to make sure that you take note of all the past physical ailments also before it degenerated into one-sided increase of the mental symptoms and it became the disease of the mind and disposition. So this is also again reiterated in aphorism number 218. And in 220, he says that you also need to observe a lot of good mental symptoms. They do not come from the patient or the attendant. They come by observation. Observation can be of an attendant or of a physician. So a lot of good mental symptoms, they are not elicited, they are observed. So observation, again, Hahnemann says, is very important when you are treating psychiatric cases. Just do not listen to the patient, also see how the patient is behaving. No patient will tell you that, not every patient will tell you that he is mentally restless. But if the patient is really mentally restless, you will be able to see that restlessness in the clinic. You can see the physical restlessness also. The patient who is physically restless might be squirming in the seat, might be moving his hands and legs. So again, the lot of things need to be observed, and so observation is important. Then he has given some more details about treating acute episodes. We'll not be going there. I'll just mention the person number 224, where he has mentioned about counseling and psychotherapy. What he has written is that not every disease needs medicine. What he has said is that if the mental disease be not quite developed, and if it still be somewhat doubtful whether it really arose from a corporeal affection or did not rather result from faults of education, bad practices, corrupt morals, neglect of the mind, superstition, or ignorance, the mode of deciding this point will be that if it proceeds from one or other of the latter causes, it will diminish and be improved by sensible, friendly exhortations, consolatory arguments, serious representations, and sensible advice. Now, these last four are nothing but psychotherapy, a form of psychotherapy. You can actually, if you study psychology or psychotherapy, you will realize that a lot of psychotherapy is based on these four principles: sensible, friendly exhortations, consolatory arguments, serious representations, and sensible advice. So what he's saying is that if the case is relatively fresh, not very deep-seated, has a fresh cause, it might not need a remedy. It's like a mental indisposition. You have all read the physical indisposition. What is physical indisposition? You binge watch a Netflix series all night, and next morning you have a headache. So you don't need a remedy for that. You need to sleep. This is indisposition. So you have a headache, but it's not a disease. So just like a physical indisposition, you also have mental indisposition. Something happened, and that is resulting into some minor symptoms. They do not always need a remedy. Sometimes they need just a friend, a party, a warm hug, some consolation, somebody holding your hand, just making you realize that you are not alone in this world, somebody boosting your confidence. There are a lot of things that actually help. So psychotherapy has a role in treatment of psychiatric disorders, but again, as a physician, you need to choose where it has a role and where it doesn't have a role. Where the medicine is required, only medicine is going to help. Okay, now in aphorism number 225, he has mentioned about the predominantly psychotic cases. He has said that there are certain diseases which originate and are kept up by emotional causes, such as continued anxiety, worry, vexation, wrongs, and the frequent occurrence of great fear and fright. Now, a lot of cases that we see do have this, where they arise because of some emotional causes such as continued anxiety, worry, vexation, wrongs, and the frequent occurrence of great fear and fright. And this kind of emotional disease in time destroys the corporeal health also. Now, what he's saying, that there are diseases which arise on the physical plane and gradually they destroy the mental plane. And here he is saying that the diseases which originate on the mental plane, they gradually can destroy the physical plane also. And how do we treat? Again, he's saying that what you need to do is you need to find the right remedy. But at the same time, it can be also treated with psychical remedies, the psychotherapy, such as a display of confidence, friendly exhortation, sensible advice, and often by a well-distinguished disguised deception. The state of health can be rapidly changed into a healthy state of the mind. And again, he is saying that with appropriate diet and regime, seemingly into a healthy state of the body. I cannot stress this enough. Try to understand that most of these psychiatric ailments, they also have a neurochemical, neurophysiological, neurochemical cause. There is a pathology there also, which manifests into disease, into the thought process. So when you are trying to heal a mental psychiatric patient, make sure that you ask them to exercise regularly, have a healthy diet, because a healthy mind lives in a healthy body. So make sure that the body is healthy. And also we do know that exercise is one of the best antidepressants in the world. Exercise alone can increase the serotonin and dopamine and can break a cycle of anxiety and depression that a lot of patients suffer from. So do not ignore when you can give your remedy. You can give your remedy, but at the same time, what Hahnemann is saying, if the patient can be improved with some advice, some general advice, some counseling, some kind of uh, psychiatric intervention, there's no need to deny that. You can give it yourself, and if you are not capable enough, or if you feel that the patient needs more professional advice, you can refer that patient. I prefer to do it myself because then I know when to stop and where the medicine has a better role to play. But at the same time, diet and regime is something that every patient of mine, I force them to follow a particular routine. I'll tell them to exercise regularly, and on every follow-up, I'll ask, are you exercising regularly? If the patient says no, I'll again remind them. I tell them that it's not optional. It's compulsory. It's part of the treatment. Because what I've seen is that when the patient is himself doing something to improve his well-being, the remedy works much better. Because the patient wants to become healthy. There is intent, not just of taking medicine, there is a desire. The patient makes that effort only when there is a desire to improve, not just by taking the medicine. They take responsibility for their body, they take responsibility for their mind, they take responsibility for their health. And when the patient takes that responsibility, it is much easier to treat those patients. Okay. Again, role of what we have been just discussing, Hahnemann has mentioned this in a person number 228, that in mental and emotional diseases resulting from corporeal maladies, which can only be cured by homeopathic antipsoric medicine, conjoined with, again, listen to this, he says that it can be cured by homeopathic antipsoric medicine alone, but conjoined with carefully regulated mode of life and appropriate psychical behavior towards the patient or the part or the part of those about him and of the physician must be scrupulously observed by way of an auxiliary mental regime. So the mode of life is important. Healthy diet, healthy exercise. If you are treating psychiatric cases, do not miss that. If you are seeing a particular patient for anxiety and depression, also look at what they are eating, what kind of lifestyle they have. A lot of these psychiatric ailments originate from bad lifestyle also, and if you do not correct that lifestyle, your Nakswamika is not going to do wonders. The maintaining cause, the lifestyle can be a maintaining cause, and what has Hahnemann written about maintaining cause? Hahnemann has written that if there is a maintaining cause, it should be removed first. And if poor lifestyle is the maintaining cause, then it should be removed first. So this is what Hahnemann has written. Prognosis Hahnemann has given, according to him, that the prognosis is always very good, very good. So I'll not go beyond this in this slide because we'll run short of time. I'll just share one case with you. And that we take a couple of questions. If you have any questions, you can just post in the chat box. We will take this after this case. We'll take just a small case where the disease originates from psychiatric cause, a psychiatric disease originating from psychiatric cause, and where both the medicine and counseling were important. Yeah. Can you see this a case of OCD?
Yes, Dr. Manish.
All right. So this is a very brief case. Now this young 19-year-old male comes to my clinic with complaint of sleeplessness since 3 months. He was just not able to sleep. He was preparing for his CA. He was a younger brother of a homeopath. And the homeopath was my student at some point of time, and she had brought her brother for treatment. Now, this young man was preparing for his CA exams, accountancy exam, chartered accountancy exams, and was under a lot of stress as he was unable to study due to his sleeplessness and anxiety. So I asked him to describe his anxiety, and he says that I cannot stop thinking. I constantly think about abusive words or sexual thoughts intrude my mind. I'm unable to stop thinking or control these thoughts. I've started talking to myself. So what kind of OCD this patient had? This patient has sexual OCD, constantly engaged, right? The same sexual thoughts would repeat again and again. And this was just a 19-year-old male. And he's unable to stop thinking or control these thoughts. And he started talking to himself. While sitting alone, he would constantly talk to himself. So this was the state. And this was a fresh case. This was a fresh case, just a couple of months, 3 months since he developed this symptom. So I asked him on inquiring about the cause, he did not mention anything. Since he was perturbed by constant sexual thoughts, I asked about his sexual life. He was a virgin, so I asked him if he masturbates. He said, I used to till 4 months ago. Now, look at this timeline. He said, I used to masturbate till 4 months ago. Now, and he has this problem since last 3 months. Something is happening here. So I asked him, why did you stop? Now, a 90-year-old male who was regularly masturbating, 4 months ago, he suddenly stopped. So what he tells me is, I have read that this is not the right thing to do. It is harmful and immoral. Our parents do not expect such things from us. And the second thing he mentioned was that once my sister has also found me watching porn, and she also counseled me about how wrong I was doing, so I stopped masturbating. So what had happened was that this young man was watching porn, and his sister actually caught him. And then the sister, being a doctor, he gave she gave him a long lecture about the sin that she was committing, that why it was not something that he should be doing. It's something that it's wrong. It's according to religion, it's wrong. It's something that the parents do not expect him to do. It's immoral. It's unhealthy. So he gets a long lecture, and obviously he feels ashamed also. And then at that point of time, he stops masturbating. So I asked him, did you develop all your complaints like these constant thoughts after that? He says, yes. So you can see now this is, although this is a case of religious OCD, sexual OCD, but you can see a very recent event that has triggered it. So a psychiatric case with a psychiatric cause. Now, what do we do? One, we'll give him a remedy, and another we'll counsel him. I'll tell you about both. What is the primary rubric here? The primary rubric here was that he has committed a crime. He has committed a sin. That was his belief. That was what he told me. He was told that this is a sin. This is a crime. This is something that he's not supposed to do. His parents do not expect him to do. So the primary rubric in this case was that the delusion that he has committed a crime. You can look at the remedies. For me, this was the case. Delusion, imagination, crime committed he had. Thoughts, sexual. You can look at the remedies based on the other symptoms of this case. I cannot show you the video case long here, so I'll just, you'll have to trust what I saw in this case. The remedy that I prescribed to this young man was Calibro. The Calibro has this very strong delusion that the child is, that he has committed a crime. There were some other symptoms also, but what I tend to do in my practice, in a busy practice, we don't usually note down, repertorize all the rubrics. What we do is we repertorize a couple of key rubrics, and we will see from a knowledge of materia medica and clinical experience which particular out of these 10-15 remedies fits the case better. So I just took these two rubrics and then gave this child the Calipromatum 30C in water solution daily. But at the same time, when I gave him this remedy, I also told him about male sexuality. I told him about how common it was for men to masturbate, how common it was for, and at what level, at what point it becomes unnatural or unhealthy. I told him that this is something that most young men do. They don't fall sick. Anything in moderation, it's not bad. Medically, it is not proven to be bad in moderation. Only excess of everything is bad. So there was a dose of counseling so that he comes out of that guilt, along with it, the right remedy. So he comes after 2 weeks, and within 2 weeks, he says, I believe it was 2 weeks. Okay, so I believe it was only in 2 weeks, and he says that there are no more sexual thoughts. He is able to sleep. Remember, he came to me for sleeplessness, not for OCD. His primary complaint was sleeplessness. He was able to sleep, and anxiety was less. And so this is a very, very brief, very short case. We deal with much more complex cases. The reason I chose this particular case was because one, we don't have time for very long cases. Only a short, recent case could be discussed. And to show you how we can approach a mental case, we have to look at the physical symptoms. This case did not have physical symptoms because this was the second type of mental cases that Hahnemann has mentioned, where both the medicine along with counseling and diet and regime, they are required for curing the case. So this is primarily what I can teach you today. It's to understand the treatment of psychiatric cases, I need to show you dozens and dozens of psychiatric cases, long histories, because there are a lot of psychiatric cases which come with very, very long histories, 5 years, 10 years, 15 years, 20 years, sometimes 50-year-old traumas children, patients come with. And the more complex the case, the more different your approach, your innovative your approach needs to be, how you tackle those cases. Sometimes you do not get the right remedy at the first consultation. Sometimes it's a layered case where you need peel one layer after another. Not every time, but yes, some cases just need one remedy. A lot of cases need many remedies, one after another, as the case unfolds. So this is primarily what I can share with you today. Our time for this webinar is up. I'm open to taking some of your questions.
Thank you so much, Dr. Manish. And Dr. Sweta, would you like to take some questions, please?
Yes, sure, now. So there is one question from Dr. Sunayana. Please explain with example well disguised deception.
Okay, this is regarding to the part of psychotherapy where Hahnemann is saying what is well disguised deception. If you actually read, he has actually given some examples also. What example he has given in some other aphorism is, for example, if a 40-year-old lady is in grief because he has lost his parents who are 80-year-old. Now at 80, you expect your parents to go. They have lived a fulfilled life. It's not an untimely death. So, but this woman is in a lot of grief at the age of 40. She is not able to come over the fact that her parents are no more. Now, one thing is you can give her ignatia or natramure or whatever remedy comes up. Another approach that Hahnemann has mentioned is that you can actually show this woman another patient. You can make somebody sit close to him, to her, and tell her about her life when the second person lost her parents when she was only 10-year-old. Then she would realize that, okay, my parents have got, but I'm still very fortunate that they lived till 80 and I was here till 40, 45, till my parents were there. I got married, I got independent, my children grew, and my parents saw everything. So my case was not as bad as I think. There are people who are less fortunate than me. And when you see someone else's pain is much more, your pain becomes less. So this kind of well concealed disguised deception is what Hahnemann has mentioned about.
Next question is how frequent gastrointestinal disturbances accompanied psycho complaint?
This is I cannot say for sure because a lot of gastrointestinal symptoms are very, very common. A lot of patients, especially those patients who have that one-sided disease which originates at the corporeal end, most of them, they tend to have some gastric disturbance at some point of time. But it entirely depends upon how the cases evolve. Some cases evolve through the gastrointestinal pathway. Some have that skin pathway. Some have some directly jump from one plane to another plane. That depends upon the genetic susceptibility. So many ways, and by itself it doesn't matter. What matters is the totality. What matters is the individuality of the case.
Absolutely. So next question is, in case taking, is there a protocol including psychological complaints?
No. There is no protocol. You just need to understand what the disease patient has come for. You need to understand the common symptoms of the disease. If you know the common, you can focus on what is uncommon. If you do not know what is common for that disease, you will not be able to find that.
Yes. When to think about next remedy or anti-miasmatic remedy?
Okay. Next remedy, when your first selected remedy is not working anymore, or the symptom picture has changed significantly, then you look for the next remedy. And same for anti-miasmatic remedy. There is no anti-miasmatic remedy. There is no blanket anti-miasmatic remedy like give tuberculinum or give sulfur or give sorinum or give mercurochrome or thuya in between. That is not the right way to use anti-miasmatic remedies. Any anti-miasmatic remedy has to cover the symptoms of the case. When you are giving an anti-miasmatic remedy, it has to be the simillimum at that point of time.
Next question is from our CA volunteer, Dr. Poonam Jhablani. Do you need to change medicines as situation changes in each case?
It again depends. There are certain cases where there's alteration of mental state, and in those cases, you do not change the remedies frequently. Uh, Most of the psychiatric cases, they do not require very frequent remedy changes. But at some point of time, obviously, if the symptom picture changes, you do change the remedy. There's nothing wrong in it.
One more question is from Dr. Harinder Man. What potencies do you usually use?
I often begin cases with 30 potency, but I use liquid water solutions, not dry pills. I very rarely use dry pills. So it's usually liquid solutions. Can begin with 30 potency, sometimes with 200 potency. Occasionally, I use dry doses of 200 or 1 m. But and then there are certain cases where I use 50 millisymbol scale also. Again, I prefer that we individualize the posology also. Posology also is a complex part, and again, Hahnemann has showed us how to individualize posology. So I tend to use that. No, I'm not. There's
Yes.
one more question about Kali group single dose. No, it was not a single dose. I never use. I use liquid solutions in most of my cases now. I don't have time to teach you about liquid solutions, but what I can briefly tell you is that the fourth edition posology was give a dry dose and then wait and watch. This was fourth edition posology. The fifth edition posology was that you give the centesimal medicine in water in divided doses. That is what I use in most of my patients. And the sixth edition posology was that you use 50 millisymbol scale.
Okay, that's all about the questions, sir. Thank you for answering all the questions very patiently. Thank you, sir. Over to you, Dr. Kavita.
Thank you so much, Dr. Sweta Singh. And today's session is very helpful, Dr. Manish, especially in my practice, which I can make use of many tips. And thank you so much for this wonderful presentation on clinical application of Organon and detailed explanation of aphorisms, especially with this going through the psychiatric cases. And I know many of them have many questions, but we will bring Dr. Manish back to our webinar since we planned for this very short session. And Dr. Sweta, okay, no more questions, right?
Dr. Kavita,
Yes, hello.
this is Ashok again.
Yes, Dr. Ashok, please.
I have raised my hand to ask permission from you to ask a question to Dr. Manish, but I will ask permission that I have to ask question along with the one examples. It may take a little time. Please let me. Thank you very much. I will do now.
Yeah, please.
Okay. Dr. Manish, that you talked about case taking, that we have to go through the whole life. Your case was very short and you took 2 rubrics. It's fantastic really that it was exactly that what you were wanting. But generally, if it is a complicated case, psychologically or mental cases, whatever that we have to go through. Exactly, question is that we have to take the totality from the beginning, childhood, this and that, everything. Why this question? Because I had an example of the recent case that there is a person who came for some polyps of the nose, this and that, but especially for the anxiety that he has a problem in the crowd. He has problem for the narrow places, this and that. But it was not enough of 1 hour something. I have to go through, and I went through with the wife and especially the mother. The came out thing was that the mother had an accident when she was in pregnancy of this man of 42 years old. So this accident, that what happened, that was a basic for me after 3 days of this interrogations going through things, because it was complicated case for me, as he explained that he started in age of 13, but came talking to the mother, it came out when she was pregnant for this thing. So situation that question that we have to take this all symptoms. There's a system, there's a process, you use the word, the process of the whole life, and the system of the person for the whole life, that we have to take many symptoms, or always it's necessary that we have to find 2, 3, 4, or 5 symptoms to write a right remedy. In this case, for me, important was to reduce first his anxiety, then it will come out. That my thoughts. But you being so expert, really, please throw a light of this whole life and the symptoms and the systems and the process of whole life. Thank you. I think I was able to tell about.
Dr. Ashok, I'm not able to understand your question.
My
So
question remains that the process of the whole life that we have to take all the symptoms, 20 symptoms.
No, you do not need to take all the symptoms in for the selection of remedy. Remedy is often, what happens is that you have got some end result symptoms. You are able to find the PQRS of this patient now, the uncommon symptoms that you have now. And these symptoms are supposed covered by 10 different remedies.
Yeah.
Okay, now when you look at the past history and the constitution, the physical makeup, the general mental makeup of the patient, or the past, even the pregnancy history of the mother, you will be able to see a remedy which covers not just the end result, but also this whole process much better. You do not need to take all those symptoms into your anamnesis. No, that is not something that you need to do. If the patient suffered from, say, whatever, say the patient suffered from constipation till 5 years ago, you do not need to add that constipation, which is not there now, to your repertorial analysis. No, that would be doing something wrong. But if you know that, for example, Kilkira Cup child has a tendency to constipation, or Illumina child has a tendency to constipation, and your repertorial totality is also bringing one of these two remedies, then you are more likely to veer towards one of these remedies, because you know that this remedy has this tendency also, or this remedy can produce this also.
But in this case, it was a trauma when the mother was in.
Yeah, so you take note of that. If there is trauma from the parents, from the mother, from the pregnancy, or something even coming from the past generation, which we call miasm, you take into account.
That's true, absolutely true, Dr. Manish, and agree, Dr. Ashok, your points also.
Thank you very much, Dr. Bhatia and Dr. Kavita. Thank you for the time.
Thank you. And we will have more discussions on this in near future, because it's very informative and enlightening for us to improve on the Organon of medicine and many of things which we can use it. Thank you so much, Dr. Manish, for this wonderful session. And we would like to take privilege to honor your gracious presence and for your precious time in sharing your knowledge and wisdom at our study group today with our CAR certificate. Please kindly accept it from our team.
Thank you so much. My pleasure, Kavita.
And with your permission, we would announce the upcoming events. On July 17th, 9 p.m. India time and 11:30 a.m. Eastern, we have Dr. Girish Gupta on experimental homeopathy. And we have many more renowned homeopaths lined up for our CAR webinars. Today, we have with us CAR volunteers Dr. Shrija Yarlavalli, Dr. Bhavana, Dr. Poonam Chaplani, Dr. Hira Agarwal, and many more CAR volunteers watching on Facebook Live. Once again, I thank CAR Homeopathy Study Group entire team for their continuous support. We always thank all the participants for their undivided attention and inspiration. And we thank Universe and all the dignitaries of CAR speakers at our webinars. Dr. Manish, we would love to bring you back again, and thank you so much for today's session.
Thank you, Kavita. I look forward to receiving your feedback, the feedback from all the people who have attended this session or those who will be listening it later. It would be wonderful to get their feedback.
And Dr. Sweta, would you like to end the session, please?
Thank you, ma'am. First of all, on the behalf of KHA Homeopathy Study Group, I would like to thank Dr. Manish Bhatia for being with us and for the enlightening session. Thank you all for joining us today. Thanks to all the viewers. And if you missed any of our webinar, you can get the recording at our YouTube channel with the name Kavita Kukunor. For the upcoming webinars, you can follow our social media pages at Facebook, LinkedIn, Twitter, and Instagram. And if you have any questions, you can reach us at kstudygroup@gmail.com. Thank you for joining us today, and don't forget to fill the jot form. You will receive the certificate within 1 week. Thank you all for joining us today. Over to you, Dr. Kavita. Shall we end?
Yeah, please. Dr. Sweta. Thank you all. See you all again at next webinar.
Goodbye.
Bye-bye.